I'm Dr. Fergus here with Cornerstone Health, and today my patient is Dr. J. It's been a while since I've had a chance to help Dr. J out, and this weekend he had some stiffness in his neck, which we'd like to look at and get adjusted. And we're doing some treatment on his right wrist, which he's been using to help treat a lot of patients, and now it's in need of some treatment as well. So let's get started. First, I'm just going to check on how Jay's neck is moving. We're going to look to the left and to the right. Good, so we have a little limitation in left side bending. Go ahead and lean to the left and to the right. Good. Okay, can you slide forward in the chair for me? That's good. I'm gonna check how the occiput is moving. Okay, we're gonna start with an adjustment here. Go ahead and lean back against me. So lean to the side. Let your head just fall towards your shoulder. Lean to this side. Okay, we're moving into the cervical spine now. That first spot's the occiput, where the neck attaches to the base of the skull, and the suboccipital muscles that can cause headaches and neck spasms attach in that area. Now we're a little lower down on C2, where the shoulder muscles come up through the neck and are limiting some of the motion. So just lean over my fingertip there. Good. With your eyes, just look up to the left. One more spot here. Okay, just lean over my fingertips. That's good. And look up to the right. Great. Okay, go ahead and sit back up for me. Okay, can you go ahead and rotate to the left? Great. And to the right. Nice, let's side bend to the left. Excellent, and to the right. Perfect. Let's head over to the table now. I'll have you lay face down here. All right, we've got some restriction here in the mid-thoracic spine. We're gonna mobilize during an exhale. Take a nice deep breath in and relax out. Once more, breath in and relax out. Go ahead and lay face up for me. Cross your arms over these rolls. Any limitation in your shoulder?
No.
Okay. Take a breath in and relax. Let's switch arms. And exhale. Great, I'll take that there. And let's have you sit at the table and we'll mobilize your wrist. So go ahead and sit up and we'll bring a chair over. Okay, we're gonna take a look at the wrist now. First, we're gonna check for supination, the ability to open up the palm towards the ceiling, and for pronation. Okay. We're gonna use this board. When I press down, it's gonna give way and make that little sound as we get some percussion. And we're gonna position the wrist so that percussion goes directly into the joint the way we'd like to mobilize it. Holding on to the ulna and the radius. Let's go palm down now. This is moving better than it was last time I checked with you. Okay, we're creating some extension of the wrist bones now. Keep the whole hand relaxed. Great. Okay, I'm gonna hold on to your wrist. And from your shoulder, I'd actually like you just to lean backwards so we create some traction here. Lean back. Great. Okay, let's go ahead and use some focused and radial shockwave therapy now. Okay, we're gonna use a few of our specialized treatments. This is radial shockwave therapy. This uses a sound wave that's gonna travel up to 2.5 inches deep into our target tissue and spurs on a phase of healing and tissue regeneration. So we're gonna focus on the muscles of the forearm that lead into the wrist with our radial shockwave therapy machine. And then we'll switch over to focused to treat the actual ligament and joints of the wrist. Okay, I'm working through a key muscle here called flexor carpi ulnaris. And we'll start here. How's the intensity there?
Good.
Let's get over this flexor carpi ulnaris. The intensity tolerable there? All right, we're gonna get a little more specific with our focused shockwave therapy. This is also using a sound wave, but from the end of the device, this can go up to 6.5 inches deep to target the specific cells that are damaged. And the unique thing about this particular therapy is if we're in super healthy tissues, no matter how high I set it, you're not gonna feel anything at all. But the moment we target this specifically on a damaged tissue that needs the treatment, you'll start to be aware of that. You'll have some symptoms, aching or discomfort in the area of treatment until that dissipates. So that helps us find the exact spot that treatment's needed. So right away, we're on something with enough intensity. We're gonna back that down. We know we're in the right spot, and we're gonna find just a tolerable intensity. Is there any sensation there right now?
Yes.
At what level?
3 to 4.
3 to 4. I'm gonna go up just one setting. Is that still tolerable at that
That's a
level? 7. Let's see if that drops down.
6.
Okay. So it's good to find this threshold when we're treating with any therapy, but especially these regenerative therapies. If we're treating at a level that's too light, we run the risk of not doing enough to actually spur on the tissue change. But if we go too intense, we also get a gripping response, and it's actually not an added benefit to go to a much higher intensity level. So usually our patients will experience a 4, 5, or 6 level of discomfort during the first part of the treatment, and that'll dissipate down to a 1, a 2, or sometimes go away completely within just 1 minute of the treatment. What number are we at right now?
4.
4, excellent. So it's coming down some. And we're gonna move just to the side here.
7.
Okay. So as we move on to a new tissue, it's elevated again as we're picking up those C fibers, which are pain-sensitive fibers in injured tissues. There we go, and down to a 3. So this type of treatment will reduce the sensitivity of those pain-sensitive C fibers in damaged tissue to make the joint more comfortable, make the tissue more comfortable, and then over a period of a few weeks, the cellular regeneration process will start to heal the tissue, and we'll get stronger, more durable connective tissue in that area. Right. Okay, let's just see how everything's moving here. Excellent. So that's a little glimpse into the treatment here at Cornerstone Health. We treated Dr. J's neck with chiropractic adjustments, treated the wrist with adjustments and radial and focused shockwave therapy. The other real key part about our treatment is doing key exercises that match all of these deficits. So at treatment with Cornerstone Health, you'll have joint mobilization, tissue mobilization, advanced therapies, and key exercises. If this was helpful, feel free to like and share this video, and we look forward to taking care of you here in Evanston, Illinois. Thanks.